Good morning to all of you, wherever you are, especially in the territory of Indonesia. I hope you are all healthy, especially during this current condition. This time, I still invite you to come down so you can think about taking a step to decide the best. This morning, I will share with you the title COVID-19 self-isolation. Indonesia is currently facing a crisis. As we can see on the picture, the amount of daily new confirmed COVID-19 case is skyrocketing. Indonesia faced the first wave at the end of 2020, and now the total case soared to the highest level ever been. As per June 29, 2021, COVID-19 new case reached 2,467 with 460 fatality and 19.82% positive rate. As the implication for this number, no significant measure have been done yet. This raised concern to the collapse of the healthcare system. The emergence of the newest SARS-CoV-2 variant also raised the concern for COVID-19 treatment. Although this has been predicted since the outbreak of the previous coronavirus disease like SARS and MERS. Viruses are constantly changing through mutation, and new variants of SARS-CoV-2 are expected to occur. There are 4 variants of concern of this virus listed on the slide. The Alpha and Beta variant are known to be 50% more transmissive. Besides that, the patients that are infected with the Alpha variant are known to be more severe and harder to treat with convalescent plasma. For the Beta variant, it can significantly reduce susceptibility to monoclonal antibody treatment and the convalescent neutralization. For this case, a convalescent neutralization is reduced in effectivity similar to gamma variant. The newest one is the Delta variant that is potentially more transmissive than the previous variant. So let's repeat one more time. There are 4 variants of concern. That's alpha variant, beta, gamma, and delta. Alpha variant, 50% increase of transmission, potential increase severity, and minimal impact on convalescent neutralization. For beta variant, 50% increase transmission, significantly reduce susceptibility to monoclonal antibody treatment, and reduce convalescent neutralization. For a gamma variant, significantly reduce susceptibility to monoclonal antibody treatment and reduce convalescent neutralization. And last, for the Delta variant, increase transmissibility, potential reduction of monoclonal antibody treatment, and potential reduction in neutralization by post-vaccination serum. Upon exposure to SARS-CoV-2, we have to monitor our health condition for any symptom possible for this disease. As you can see on the picture, the most common symptom for this disease are fever, cough, tiredness, loss of taste and smell. The other less common symptoms are sore throat. This can be found in the Delta variant infection, headache, body ache, diarrhea, rash, and eye redness. And if you have difficulty breathing, as well as loss of speed and mobility and chest pain, you should immediately seek for medical care. So, when should we self-isolate? The self-isolation must be done immediately if you have any symptom of COVID-19. If you test positive for COVID-19, someone you live with has symptoms or test positive, you've been told that you have been in contact with someone who tests positive, and of course, after traveling. So let's see this picture in the right side. This is COVID-19 spread this way. See this one step behind if you self-isolate only when you know you are infected. And also, if you self-isolate, if you or a close contact known they are infected. So, after knowing that one, this must be done immediately. In fact, if we start isolation after the symptom occur, it is already late, and you might have transmitted the disease to another person. And then the next question might be, when is the best time to be tested? The picture on the right side explains about the estimate variation over time in diagnostic tests for detection of SARS-CoV-2 infection relative to symptom onset. From the picture, we can see that before the symptom occur, it is hard to identify it using the swab PCR test. There is only a week after the exposure that we see the detection probability for PCR test increasing. And one should not be taking the rapid antibody test for COVID-19 diagnostic anymore, because the immunoglobulin M and immunoglobulin G antibody can be detected after recovery phase. So, testing too close to exposure could result in samples that do not contain enough of virus genetic material to register as positive. The optimal test time for COVID-19 diagnostic are 8 days after exposure or 3 to 5 days after symptom occur for a PCR test, and 4 to 5 days after exposure or 1 to 5 days after symptom occur for rapid test. For the rapid antigen test. If we got COVID-19, then what should we do? First, we have to identify our condition. The way WHO has been classified the severity of COVID-19 cases to 3 categories: non-severe, severe, and critical. For non-severe patient, there is absence of critical disease sign. For a severe patient, the oxygen saturation is below 90% with low respiratory rate and have sign of severe respiratory disease. Patients that require life-sustaining treatment such as ventilator, exhibit acute respiratory distress syndrome, sepsis, and septic shock are belong to a critical condition. The WHO recommend that patients with non-severe condition undergo the self-isolation to give the medical service priority for the patient with life-threatening condition. So let's repeat once again. COVID-19 severity. This patient with confirmed COVID-19 can be divided into three categories: non-severe, severe, and critical. This is absence of sign of severe or critical disease. For severe, saturation of oxygen less than 90% on room air, respiratory rate higher than 30 in adult, raised respiratory rate in children, sign of severe respiratory distress. For a critical severity, require life-sustaining treatment, acute respiratory distress syndrome, sepsis, and septic shock. And WHO recommend that patients with non-severe condition are recommended to undergo the self-isolation to give the medical service priority for the patient with life-threatening condition. This is also related to the limitation of ICU bed for COVID-19 treatment. As you can see on the picture, we are facing a crisis where the bed occupancy rate for COVID-19 patients is near 100%. Some hospitals reported that they treat more patients than they should, and the capacity reached more than 100%. This information leads us to the fact that our hospital system is collapsing and the disaster management must be taught, please. There are several things that have to be prepared before the self-isolation for the non-severe COVID-19 patient. There are tools and help that we can get for this, such as buying the portable oxygen tank, this one, portable oxygen tank, and monitor the temperature and oxygen saturation using a thermometer and pulse oximeter. Besides that, other measures are getting the sunbath every morning, take appropriate amount of vitamin and healthy diet. If need, the patient can try a telemedicine with a doctor to minimize transmission risk. In this area, let's say you can ask by using a telemedicine from Rumah Sakit Universitas Indonesia RSUI in Depok campus, and also you can ask Rumah Sakit Cipto Mangunkusumo. It's helpful. Monitoring of inflammation parameter is also important for COVID-19 patient. Severity of COVID-19 cases is linked with the infection induced hyperinflammation and cytokine storm. Monitoring this parameter help evaluate inflammation level in a patient. There are several parameters that need to be tested, such as C-reactive protein, D-dimer, procalcitonin, and interleukin 6. COVID-19 patients are often having higher than normal amount of this parameter due to infection and inflammation. So, regarding the medicine that the patient has to take during self-isolation, there are many misleading information about this. I should mention once again, regarding the medicine that the patient has to take during self-isolation, there are many misleading information about this. But the WHO has made a guideline on this. Let's see this one. This part do and this part do not. This one consume prescription drug only. If fever, you can use paracetamol 1 to 2 times a day for 650 milligram tablet and do cold compression. Saturation between 90% to 94%. Use portable oxygen and do telemedicine. Do not do by yourself only. Ask for the help of a doctor. Use this telemedicine. As I have already mentioned before, you can use telemedicine of Rumah Sakit Universitas Indonesia in Depok, and also Rumah Sakit Cipto Mangunkusumo in Salemba, Jakarta Pusat. Saturation less than 90% get hospitalized. If not possible, use steroid, methylprednisolone, or dexamethasone. And do not forget that vitamin D 100 EU for a day. And the most important thing also, you should keep in mind that you could not or do not take unprescribed antibiotic by yourself. Do not take unprescribed steroid. It can cause fatality and fungal infection. Do not take hydroxychloroquine, lopinavir, ritonavir, and do not take remdesivir unless told. And last, do not use ivermectin. WHO strongly suggests the usage the ivermectin only on clinical trial. So, when are the patients considered to be recovered from COVID-19? According to the WHO and CDC guideline, for a symptomatic patient, isolation can be discontinued 10 days after the date of the first positive real-time PCR test result for SARS-CoV-2 RNA. And for the symptomatic patient, isolation can be discontinued 10 to 14 days after symptom onset and after resolution of fever for at least 24 hours. Then let's see one more time this timeline for people with COVID-19 who do not have a symptom. This is exposure in a virus, and this one, the time. So let's see this one. Incubation period. The virus is spreading in your body. This takes 2 to 14 days. Then this is the day you test positive. Then see this one, infectious period. The virus can spread to others starting 2 days before you got tested. So you should keep in mind and take of this point. Isolation, stay home to stop the virus from spreading. It takes about 10 days if you remain without a symptom. So do not go outside. Stay at home. Then, if you see this table or timeline for people with COVID-19 who do not have symptoms, so at this time, someone can release from isolation. So, I think that's all for this moment. Thank you so much. I hope you can get this information. You can share this information to your colleagues, to your family, and to your neighborhood. Take care yourself. Good morning, and thank you so much. Thank you.